I'm Heidi Clopton, occupational therapist, and this is a form of therapeutic brushing in order to help calm down the touch system and help children to accept touch better and to calm down their light touch sensitivities. So we have an oval surgical brush. Comes in this cute little package. And so we have a full bristle side, and then we have a side that's meant to clean a surgeon's fingernails. So we're going to use the full bristle side, and we're going to hold it horizontal to the skin. So this way, not this way, but horizontal to the skin. So this is Jace, and he's going to be our guinea pig here. And so we're going to put down full pressure so that the bristles are bending back. And we're going to go up and down the arm. And Jace, I need you to sit up so I can get your back next. So it's a nice full deep pressure going up and down the arm. You want to make sure that you cover very well. And then we're going to continue on the back. We're going to go up and down the back. Like this. And then we're going to come down this arm. So you want to keep nice, consistent, deep pressure so that the brain is calmed and not alerted. Should we get the hand? The palms of the hands are one of your most sensitive areas, so you want to make sure you don't forget to brush the hand. So just make sure that you've covered everything. A lot of times I'll do the hand a couple of times and go back and forth over the hand because it is so sensitive. We want to calm down those light touch receptors and give nice deep pressure touch. And then we can do a swipe down the back and start on the outer thigh. And of course, brush to skin is best rather than over clothing when you can do it brush to skin. Sometimes that's hard to do if you're in public, so you can do it over clothing, but it's best to be done on the skin. Okay, and then we can go up around the back and then come down so that we don't let the brush up. And again, the most calming input is the nice, long, deep strokes. And you never want to force brushing. You always want to do it as something that is calming and not forced to a child. So that's it for the brushing. So after you've given deep pressure therapeutic brushing, the best thing to do is to follow that with joint compressions. This releases serotonin in the brain and tells the brain that us being in their space and that touch can be calming and kind of reorganize how the brain sees light touch and see people in their space and touching their body and things on their skin as a calming instead of alerting. So joint compressions can be started on the straight, hold it at the base. We're going to pull and push. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then for the fingers, we're going to pull and push. You can do all 4 at one time if you feel like you've got a good grasp, or you can do them individually. And it's just a pull and a push on a straight joint. Obviously you can't do that if the joint is bent, so just make sure the joint is straight and pull and push. Do the wrist, so it's like you're at a handshake and it's pull, push. And then elbow, straight. You can have a little bit of bend, but not much. It's a pull, push. And then shoulder. I'm going to cup the elbow, and you can't pull out very well on the shoulder because there's so many muscles around it, but you can push in. And then you would repeat on this side. For the legs, if they're not able to jump, then you can do the same thing on the ankle. You can do the toes if you feel like it, but it's not necessary. The knee. And then to go into the hip, you have to bend the knee a little bit, cup your hand behind their hip, and push against your hand. A lot of times if the child is able to jump and it's not a calming time, like they're not laying down on a calming mat or in their calming space or in bed, then if they're up and moving about, it's easier just to hold their hands and have them jump. Same for joint compressions on the arms. If they're up and moving and it's a time when they're up and moving about, then you can have them wheelbarrow walk. You walk, take a few steps. Wheelbarrow walk. Or if you have a ball, you could roll out. So just roll over the ball and put your hands out and go back and forth. If you don't want to hold their legs or they're too large for that, then you could do an activity where they're kind of rolling back and forth and getting some joint. Just kind of hold yourself up on your hands as you go out. So now walk out a couple of steps. They can do their own wheelbarrow walk that way if you don't feel comfortable holding their legs. Now walk back. Another option is to work with a weighted ball. Following that. And so you can play weighted basketball with a weighted ball. One more option for joint input following brushing would be row, row, row your boat for a smaller child. And that's where we're going to pull and push over the ball and do row, row, row. And that would be appropriate for a smaller child that likes to sing songs and likes that kind of thing. There you go. Thank you.